The Blend is pleased to welcome Dr. Terry Tucker on the show today. Dr. Tucker is an eye doctor and owner of the Tucker Vision Center in North Fort Myers. And this morning he wants to show us a new pair of frames that are not only helping people see better, but breathe better as well. Good morning.
Good morning.
So this is pretty fascinating, and I have to say, this is big that you're here this morning. It's big that you are carrying these glasses. You are the only dealer that has these glasses in what, 4 counties?
4 counties.
In our area.
Yes.
So explain what these glasses are. We're seeing them right here, but these are for people who have to unfortunately carry around the oxygen tanks, right?
That is correct. With the old type of breathing apparatus, it came around their neck, up through here, around behind their ears, came across their cheeks, and then into their nose. With the new procedure they have here, the oxygen tubes come up through the back of the frame. So it doesn't come across their cheeks anymore, comes up through the temple piece or the side piece across the top, and then comes down through the nose to allow them to breathe. That gives them more self-esteem.
Yeah.
They certainly look much better, much more comfortable, because you don't have the temple piece resting on the oxygen coming over the ears. Okay.
Let me show a picture of this, because this is one of the brochures that you can pick up at your office.
Yes, ma'am.
And this shows a woman who has the tubes using them, and you can really see how they're very visible. And then with these new glasses, I mean, you can't even tell that you have them on.
You cannot tell she is even using any oxygen whatsoever. And with the new apparatus with your tanks, they look almost like a purse, so most people don't even know you have it. It frees you up for many activities. I've had patients who were golfers who now, when they got the oxygen, had to use the oxygen. They couldn't play anymore because the tubing was hanging all over them. Now it comes up through the temple pieces, so they can go out and play golf now, and they're very, very happy with that. I've had many come back and say, it's just amazing that I can go out and play golf now without having everything hanging all over everywhere, so they're very happy. It also, a lot of people on oxygen feel self-conscious using the oxygen.
Why, yeah.
And with this, it's almost, you really have to pay attention to whether they have oxygen or not anymore. So it's a wonderful thing for them. The nice thing about these two, they come in 2 different styles. One is a temple that will not bend, and then they have temples that will actually bend and spring-loaded for them too. So there's several different styles available, several different coloring choices available for them to use. So it's been just a tremendous improvement for people who have lung problems or using oxygen.
And this is such a big improvement, but yet a lot of people don't know that these are available. Why do you think that is?
I don't think the information has got out in the media, and that's one of the things we're doing here today.
That's why we love our show, so we can tell you.
To get that information out to people, and we're going to start working with the pulmonologists in the area to let them know this is available to their patients they have on oxygen. And the nice thing about this, the cost is really inexpensive compared.
Tell me a little bit more about the reaction you're getting from the people who have discovered them.
Well, I've actually had patients clear from Sebring and other places coming in to try to get the glasses, because it's just, it's amazing how they feel so much happier. And obviously the self-esteem has been excellent. Just now I go out anywhere. When I used to carry all the oxygen and the tubing around, they didn't want to really go anywhere. So now I go out shopping, I go out to dinner, I go a lot of places, and very comfortable now wearing this.
And imagine it would feel freeing almost.
It's very freeing for them to not have all that tubing around their neck, around their cheeks, and around their ears. Much more comfortable for them.
Are there some patients that this would not work for, or does this pretty much work for most people with?
Anybody that is using the oxygen, it will work for.
Okay.
Anybody.